All right, welcome to the Explainer. Today, we are diving into a really critical topic in diabetic health. We're talking about a high-stakes condition that can quite literally determine the long-term future of your kidneys. So, after something like an infection or maybe a hospital stay, your kidneys can enter this really pivotal phase. It's called acute kidney disease, or AKD. The best way to think about it is like a 90-day crossroads, and the path that's taken in that window can be the difference between a full recovery and, well, lasting damage. So the big question is, what does the modern roadmap for navigating this critical window actually look like? Well, the good news is, treatment has been absolutely revolutionized. You see, for decades, the options for protecting kidneys were pretty limited. But the last 10 years have sparked a complete revolution, bringing in a new guard of drugs that have totally changed the game. For the longest time, a type of drug called RAS blockers were basically the only line of defense. But then, the 2010s came along, and with them, two breakthrough classes of drugs that completely redefined what was possible for both kidney and heart health. So let's meet these breakthroughs. We have SGLT2 inhibitors, they help your kidneys get rid of sugar, and we have GLP-1 receptor agonists, which help manage blood sugar, but also have these incredibly powerful protective effects. You put them together, and they have transformed our ability to safeguard both the kidneys and the heart. Now, let's just zero in on those GLP-1 RAs for a second, because the numbers here are, well, they're staggering. We're looking at real-world data showing that for patients in this critical AKD phase, these drugs are linked to a 43% lower mortality rate. And on top of that, significantly fewer major kidney and heart events. It's huge. So what does this leap forward actually look like? You can see the difference in defensive strength right here. I mean, while the older drugs offered some protection, sure, these newer therapies provide a much, much stronger defense against kidney disease getting worse. It's a whole new level of security for your body. So we have these powerful, proven new tools that can literally save lives and protect kidneys. The logical next step is that they're being widely used, right? I mean, it just makes sense. Well, this is where the story takes a really puzzling turn. And here is that puzzle, laid out in a chart. Despite all their clear benefits, the prescription rates for these newer, more effective drugs are, honestly, they're shockingly low. We're talking less than 5% for eligible patients, while the older standard of care is prescribed way, way more often. It's the central question we have to answer, right? If these medications are so incredibly effective, what is causing this massive gap between the science and what's actually happening in practice? And it turns out it's not just one single thing, but more of a mix of systemic challenges. You have something called clinical inertia. That's just the natural lag in adopting new treatments. But there are also some outdated safety concerns, cost barriers, and sometimes it's just a simple lack of awareness about the very latest guidelines. This gap between the evidence and the practice, it really highlights a key opportunity for patients, for you, to become an advocate for your own health and to make sure you're getting the most current, effective care out there. So, how can you take charge? It really comes down to three key actions. First, know the risk. You have to understand that any acute illness can be a trigger. Second, ask about new options. Start that conversation with your doctors specifically about SGLT2 inhibitors and GLP-1 RAs. And third, always prioritize follow-up care to make sure your kidney health is being watched closely. So we'll leave you with this question to think about. The science has evolved, creating incredible new pathways to protect your health. It's absolutely crucial to make sure your care plan has evolved too.